And tonight, New York City is once again in desperate need of ventilators. Governor Cuomo has issued an executive order allowing the National Guard to redistribute ventilators from hospitals in the state that are not using them to hospitals most in need. And this is why they are so important. New York State saw its biggest single-day increase in coronavirus deaths. 562 people died from the virus over the last 24 hours. That is a 23% jump. And right now, there are about 102,000 confirmed cases of COVID-19 in the state, with more than 56,000 of them in New York City. The total number of deaths statewide has now reached nearly 3,000. That is more than the number of people who died on 9/11. And Mayor de Blasio says that there is also a dire need for additional healthcare workers. The city even issuing an emergency alert via text message in an effort to recruit medical personnel. Now, some doctors fear that they're fighting a losing battle, outmatched by the rapid rise in cases, and it will likely be worse next week. Here is CBS 2's Brennan.
We're really struggling, and at this point, we're really stretching, and we're doing the best we can.
Dr. Stephen Constadt on the front lines and under siege at Maimonides Medical Center in Brooklyn.
We're stretching ourselves as much as we can, but frankly, we're waiting for the cavalry.
Governor Cuomo hopes the cavalry comes in the form of ventilators. He's issued an executive order to transfer ventilators to facilities that need them, enforced by the National Guard.
I can't do anything more than that, but I'm not going to be in a position where people are dying and we have several hundred ventilators in our own state somewhere else.
Mayor de Blasio says the city is approaching a D-Day. He says hospitals are desperate for increased staffing and made a plea to President Trump.
So I'm urging the president to do something that no president has had to do in our modern history, to create an enlistment effort for our medical personnel, civilians all over the country.
The president says he's working with New York, but said it's well served with ventilators. He also issued a voluntary call for using face coverings, even if he wouldn't do it himself.
I don't think I'm going to be doing it.
The coronavirus has hit every neighborhood, of course, in New York City, but the impact, city officials say, has not exactly been equal.
This map shows the hot spots by zip code, the dark purple with the most cases. Councilman Richie Torres represents some of the hardest hit areas of the Bronx and is himself recovering from COVID-19.
It is frustrating when I hear anyone say this does not discriminate, because it erases the racially disparate impact of the coronavirus outbreak. It erases the fact that Queens and Bronx are taking far more casualties than the rest of the city.
The city decided that the medical ship Comfort can now take patients directly from ambulances instead of having to first go to hospitals to get a negative virus test. But by next week, many more beds will be needed.
Every hospital is unbelievably busy and preparing to get busier because the numbers keep escalating.
A race against time to save lives. Dick Brennan, CBS 2 News.